Gentlemen, let's speak openly for a moment. There's a question many men over 60 think about quietly, yet very few feel comfortable discussing out loud. How often should you be masturbating at this point in life? Some people say, as often as you want. Others caution that you should slow down, or even stop altogether. It's confusing, isn't it? And deep inside, what you really want is a clear, science-backed answer, free from judgment, embarrassment, or old-fashioned myths. I'm Dr. Ella, and for the past 7 years, I've worked as a urologist helping men deal with these exact concerns. Today, I'll explain the rhythm that best supports your body, your energy, and your overall health, so you can enjoy your sexuality without guilt, without feeling drained, and with real confidence. Before we get started, please like this video, share in the comments where you're watching from, and subscribe. That way, you won't miss advice designed to keep your health strong well into later life. Now here's the reality. Masturbation in your 60s is about much more than simple release. It's not something to feel ashamed of. It reflects your blood flow, hormone balance, prostate condition, and even your emotional health. Many men assume they either need to do it frequently to stay well or quit completely to conserve energy. Both ideas are mistaken. Your body follows a natural rhythm, and discovering the right frequency isn't about a fixed number. It's about what helps you feel capable, content, and energized. Think of it this way. Sexual activity acts like routine upkeep, similar to lubricating a machine. When done properly, it helps everything work smoothly. When neglected for too long or overdone, it can leave your system feeling slow, tight, or unsettled. From a biological standpoint, masturbation involves the entire body. As arousal starts, your heart rate rises, sending increased blood flow to your limbs and pelvic area. Your pelvic muscles begin gentle, repeated contractions, which supports muscle strength and healthy circulation. Your brain releases dopamine for pleasure, oxytocin for calm and connection, and a mix of other neurotransmitters that influence your mood, stress levels, and sleep. Meanwhile, your prostate produces and releases fluid, keeping tissues healthy and ducts clear, essentially flushing the system. When you were younger, recovery was quick. Hormone levels bounced back, blood flow returned fast, and your nervous system reset almost immediately. After 60, this process slows down. Testosterone production drops, circulation is a bit slower, and your nervous system needs more time to recharge. This doesn't mean you should stop. It means you need a rhythm that respects your body's pace and ensures every session leaves you satisfied, not exhausted. Now, let's look at the biggest mistakes men over 60 make and how they can impact sexual health. Mistake number 1, doing too much. What happens? Fatigue, reduced sensation, pelvic discomfort. Here's why it matters. Your nerves, blood vessels, and prostate all need time to recover. Overdoing it is like overtraining at the gym. Your muscles just can't perform at their best. Watch for warning signs: weaker erections, sluggish mornings, less pleasure, or mild irritability. Mistake number 2, doing too little. What happens? Erectile tissue loses some elasticity, blood flow slows, and tiny scars can form. Over time, fibrosis may develop. Why it matters? Infrequent activity reduces responsiveness, weakens pelvic muscles, and makes erections less dependable. Red flags include rare spontaneous erections, tension in the pelvic area, or heightened stress and irritability. Mistake number 3, ignoring lifestyle factors. Hydration, sleep, exercise, and diet all play a role in sexual health. Without these, even the right rhythm won't deliver the benefits your body needs. So, how do you find your ideal rhythm? Here's what I suggest for most healthy men over 60. Step 1. Begin with every 3 to 5 days. This frequency is enough to keep circulation healthy, hormones balanced, and the prostate functioning well, while still giving your body time to recover. Step 2. Treat it like a personal experiment. After each session, ask yourself, do I feel energized or drained? Is my mood steady or irritable? Are my erections strong and satisfying? Use these cues to adjust the timing slightly. Your body knows what it needs. Pay close attention. Step 3. Support your body before and after. Hydrate. Water improves blood flow to erectile tissue and maintains energy. Move. Even a brisk walk increases nitric oxide, which helps strong erections. Sleep. Deep, uninterrupted rest allows testosterone to peak naturally in the morning. Eat well. Leafy greens, beets, salmon, and berries nourish your vascular and nervous systems, protecting function and flexibility. Step 4. Watch for signals. Weaker erections, dull sensations, pelvic discomfort, or mood shifts mean you need more rest. Rare spontaneous erections, tension, or frustration suggest it may be time to be more active. Step 5. Make it part of your lifestyle. Combine the right rhythm with healthy habits, and masturbation shifts from a guilty pleasure into a tool for overall vitality. Your energy, mood, and sexual responsiveness all benefit. Science supports this. A notable Harvard study found that men who ejaculated about 4 to 7 times per month had a lower risk of prostate issues than those who did so rarely. Regular activity helps flush and maintain prostate health, keeps blood flowing to erectile tissue, and supports nitric oxide production, the molecule that relaxes arteries and allows blood to fill the penis. After 60, nitric oxide naturally declines, so regular, but not excessive, sexual activity helps preserve vascular responsiveness and strong erections. Gentlemen, here's the key takeaway. Your body isn't broken, and your sexuality hasn't vanished. It's simply evolving. Age doesn't take away your pleasure or confidence. It asks for a smarter approach. Small changes, spacing sessions thoughtfully, staying hydrated, sleeping well, moving, and eating nutrient-rich foods can make a remarkable difference. You can feel vibrant, confident, and fully satisfied well into your 60s, 70s, and beyond. I also want you to recognize the specific signals your body gives about your rhythm. Too much, fatigue, dull sensitivity, or pelvic heaviness is like overtraining. Your body needs recovery days. Too little, rare spontaneous erections, tension in the pelvic area, or rising stress, is your body inviting you back into a healthy routine. Your goal is self-tuning. Adjust based on your own energy, mood, and performance, not someone else's rules. Here's how to support a healthy sexual rhythm every day. Hydration. Keeps blood volume up and circulation strong. Movement. Brisk walks, light resistance, or gentle stretching improve blood flow and nitric oxide levels. Sleep. Quality rest boosts testosterone naturally and stabilizes mood. Diet. Leafy greens, beets, salmon, and berries nourish blood vessels and nerves. Stress management. Meditation, deep breathing, or hobbies lower cortisol and maintain sexual responsiveness. Combine these habits with your rhythm, and masturbation becomes a healthy part of your lifestyle, not a guilty secret. So, gentlemen, here's the key takeaway. Starting with masturbation every 3 to 5 days is ideal. Pay attention to your body. Ignore myths or random numbers you see online. Support your health with proper hydration, regular exercise, quality sleep, and good nutrition. Treat your sexual rhythm as part of a bigger plan for vitality, not a source of shame. Age doesn't end pleasure, energy, or confidence. With a little care, you can enjoy comfort, freedom, and satisfaction every day. If you found this video helpful, like it, subscribe, and comment below with where you're watching from. I'd love to hear from you. Respect your body, honor your needs, and savor every moment. Your sexuality is yours to celebrate, and it can thrive well into later years. Don't forget to subscribe for more health tips for men over 60. Remember, age is just a number, and your vitality is in your hands.